whether there are particular insurances that you don't accept, whether you don't accept Medicaid, if you don't accept particular managed care, Blue Cross Blue Shields, Aetnas, or Humanas, or you're not accepting any other local insurances. Look, what are the reasons? Are you not accepting certain patients with wound problems because you don't have good nurses who are trained in wound therapy? You need to be able to make sure that what in the past has caused you to not gain any referrals. And sometimes when you refuse one referral, you will definitely lose the rest of the referrals in the future from that physician, from that hospital, or any other referral sources. What they want is that when they pick up that phone, when they call you, you are the reliable person that can actually take care of anything that they need. They don't want to waste their time. Don't let people waste their time. The biggest thing that you can do is agree and say, yes, we'll take care of the patient. And once again, like I've asked and I've told you in previous videos, is ask for a secondary concession or a referral. Ask them for a referral. You did them a favor, right, by taking care of that hard patient or that patient. Look, they're not doing you a favor. You're doing them a favor because your agency is a great company and you know that and that you want to take great care of their patients. So you're doing them a favor as well. So since you're doing them a favor now, ask for a secondary concession. Ask them for a referral. Ask them, look, we want to be able to take great care of this patient and we want to be able to take care of more patients. Do you have any more patients that we can care for? If you're talking to a discharge planner, of course they have more patients. They're discharge planners. Of course that social worker has more patients coming and they're willing to give you because they're social workers. And if you're talking to a physician, well, guess what? He has more patients and he knows physicians with more patients. Don't ever forget to ask for secondary concessions for those referrals. And yes, I'm sure that as a home health person, as an owner, as an administrator, you have had the wrong people work for you. And I understand that. And if you have recognized that they are the wrong people, get them out of your company. Don't keep poison within because eventually it will spread. And yes, knowing this, just like myself in the past who have hired the wrong marketers and learned from it, I want you to learn from me and not experience the stuff that I've experienced in the past. So if you had bad marketers in the past, that could have caused problems for you. You want to be able to find marketers, or if you are a marketer, you want marketers that are great, that are hungry, that wants to be able to be successful. You don't want marketers, or you don't want to be someone or who goes to physicians' offices and all of a sudden all that is being done is dropping off flyers, dropping off business cards saying call me, or not even saying that. You need to be aggressive. Your marketers need to be aggressive. You need to be able to learn how to pressure people, but pressure them the right way because you know that you have a great product and your services are great. So why wouldn't you have to pressure people? Why wouldn't you be happy to pressure them? Because look, if they use your products, you're going to give them great services. So as we continue on, we're going to have more information for you guys to be able to help you guys. The next thing is, look, you need to be able to learn how to close. There's a lot of people out there who are able to present well, but doesn't know how to close and get that referral. Or they may be able to be, good at being able to open up deals, but doesn't know even how to present. Look, if you never get a close, if you never get that closing, if you never get that referral, you never really close the deal. So you need to be able to learn the techniques on how to be able to close the deals, to close these referrals. So we actually have a full series on closing, and we definitely recommend that you guys watch that closing. It's closing for referrals. Look, like I said, you may be able to open up the account well. You may be able to have a great presentation. You may be able to ask the right questions. You may be that chosen person that they want to be able to call their buddy. You have that instant rapport with them. But look, until you actually get a referral, it's not an end deal yet. Once you get a referral, then you have that deal with that person. But until you get that close, it is not a deal. It is not a transaction yet. You need to be able to learn how to close, and we actually have a full video series for that. And so make sure you reach out to us so we can direct you to how to be able to learn the techniques in closing to get referrals.